Much, Dr. Birx, Mr. President, Mr. Vice President. So what Dr. Birx has really said very simply is that there are really two dynamic forces that are opposing each other here. As I've mentioned several times in our briefings, the virus, if left to its own devices, will do that dark curve that Dr. Birx showed you. The other dynamic force is what we are doing, what we're trying to do, and what we will do in the form of mitigation. Now, these are very revealing bits of data because you saw what happened in Italy, where you make the turn around the curve and you go. That doesn't happen all at once. It's a stepwise fashion. And if I explain the steps, which I will, you'll see why we are really convinced that mitigation is going to be doing the trick for us. Because what you have is you have increase in new cases at a certain rate. When the increase in new cases begin to level off, the secondary effect is less hospitalizations, the next effect is less intensive care, and the next effect is less deaths. The deaths and the intensive care and the hospitalization always lag behind that early indication that there are less new cases per day, the way we saw in Italy. And the way we're likely seeing, I don't want to jump the gun on it, we're seeing little inklings of this right now in New York. So what we're going to see, and that's we got to brace ourselves, in the next several days to a week or so, we're going to continue to see things go up. We cannot be discouraged by that because the mitigation is actually working and will work. The slide that Dr. Birx showed, where you saw New York and New Jersey and then the cluster of other areas, our goal, which I believe we can accomplish, is to get the hotspot places, the New Yorks, the New Jersey, and help them to get around that curve. But as importantly, to prevent those clusters of areas that have not yet gone to that spike, to prevent them from getting that spike. And the answer to that is mitigation. Now, the 15 days that we had of mitigation clearly have had an effect, although it's tough to quantitate it because of those two opposing forces. But the reason why we feel so strongly about the necessity of the additional 30 days is that now is the time, whenever you're having an effect, not to take your foot off the accelerator and on the brake, but to just press it down on the accelerator. And that's what I hope and I know that we can do over the next 30 days. And as I said the other day and on one of the interviews, we are a very strong and resilient nation. If you look at our history, we've been through some terrible ordeals. This is tough. People are suffering, people are dying. It's inconvenient from a societal standpoint, from an economic standpoint to go through this. But this is going to be the answer to our problems. So let's all pull together and make sure, as we look forward to the next 30 days, we do it with all the intensity and force that we can. Thank you.